Bonjour à tous, bienvenue à la conférence de presse d'aujourd'hui. Hello everyone, welcome to today's press conference. Je passe la parole au ministre.
I give the floor to Minister Dominique Leblanc.
Merci beaucoup.
Thank you very much, Corinne. Good afternoon, everyone.
Today I'm joined by my colleague, Minister Anita Anand, and Doctors Tam and New as well. We have seen encouraging signs in the last weeks. The numbers of Canadians with COVID is decreasing, but obviously all governments remain concerned about the COVID-19 variants. Nous savons.
We know that it hasn't been easy for Canadians, and we thank you for everything that you are doing to fight against COVID. Now is not, and we've said it's from the beginning, it is not the time to travel.
Is clearly not the time to travel. We must remain vigilant. Thank you for continuing to respect social distancing, wearing a mask, and following local health guidelines. We will get through this together. I would now like to hand the microphone to my colleague, Anita Anand. Anita.
Bonjour tous les.
Good afternoon, everyone, and thank you very much, Dominic.
Recognize that I'm speaking to you from the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples. I have a brief update on vaccine procurements. This week, we are receiving a total of 643,000 doses of Pfizer and Moderna vaccines, the largest shipment to date, and the majority of which have already been delivered. By the end of this week, a total of 2.5 million doses will have been delivered, and another 3.5 million are arriving in the month of March.
My team and I are working tirelessly to accelerate the delivery of vaccines as quickly as possible. That includes ensuring that the 40 million Pfizer doses are delivered by the end of September.
Temporary disruption to supply chains, Canada will receive 6 million doses of vaccine prior to the end of March, as planned. A total of 29 million cumulative doses will be delivered before the end of June and 84 million prior to the end of September. These figures include only the 2 currently approved vaccines. Nous veillons à ce que
We are ensuring that Canadians have access to vaccines as quickly as possible by moving ahead our long-term vaccine deliveries to vaccinate more Canadians.
I'd like to take a moment to address vaccine security. Just as there is a significant amount of disinformation circulating about vaccine deliveries and safety, there are, unfortunately, some individuals looking to take advantage of the hyper-demand globally for vaccines. My department of PSPC has verified every officer it receives with the vaccine manufacturer directly. In many instances, after contacting the original vaccine manufacturer, these purported intermediaries are referred to the RCMP for potential fraud investigation. We take the safety and security of the vaccine supply chain very seriously. Rest assured that I and my team follow up on every legitimate offer of vaccines and refer all suspicious offers to the appropriate authorities. Deliveries of vaccines are resuming in significant numbers and will continue to increase in the months ahead. Our plan to have enough vaccine for everyone who wants one by the end of September is working, but we are not out of the woods yet. It is just as important as ever that we all continue to follow public health advice and keep each other safe. Thank you. Merci. Miigwech.
And now we'll turn it to Dr. Tam and then Dr. New. Dr. Tam?
Thank you, Minister. So, bonjour à toutes et à tous.
Good afternoon, everyone.
849,517 cases of COVID-19 in Canada, including 21,723 deaths. Disease activity and severe outcomes continue to decline nationally, and there are now just over 31,000 active cases across the country. Over the past week, on average, about 2,900 new cases and 54 deaths were reported daily. In our hospitals, under 2,400 people with COVID-19 were being treated each day, including about 530 in critical care. There are now over 849 variants of concern cases, including 780 B117, 39 B1351, and 1 P1 variants. Overall, we're still doing well, but things could change rapidly, as we have seen recently in Newfoundland and Labrador, where highly contagious variants of concern took hold when public health measures were less stringent. Provincial public health authorities knew something was different when cases escalated over a matter of days, even before laboratory evidence confirmed the presence of the B117 variant. There are also international examples from the United Kingdom and Ireland, where an exponential trajectory occurred following the emergence and rapid predominance of the B117 variant of concern. These areas had public health measures in place, but they proved insufficient to control the spread of a highly contagious variant. Achieving the best case scenario with highly transmissible variants in our midst requires us to continue being vigilant. Any easing of public health measures must be done slowly with enhanced testing, screening, and genomic analysis to detect variants of concern. In particular, there must be sufficient contact tracing capacity and supports for effective isolation, given increased transmissibilities of these variants of concern. As we head into spring, vaccination efforts will continue to ramp up, bringing us closer to widespread and lasting control. Recently, we've seen some very encouraging early reports of high vaccine effectiveness among long-term care home residents and healthcare workers in Canada. This gives us hope that those at highest risk of severe outcomes or exposure are benefiting from priority vaccination. Until vaccine access expands to protect all Canadians, our best means of control continues to be our collective effort to slow the spread through enhanced public health measures combined with individual prevention practices. Controlling COVID-19 may not be easy, but we are stronger together.
Bonjour à toutes et à tous.
Good afternoon, everyone. There have been 849,517 cases of COVID-19 in Canada, including 21,723 deaths. Disease activity and severe outcomes continue to decline nationally, and there are now just over 31,000 active cases across the country. Over the past week, on average, about 2,900 new cases and 54 deaths were reported daily. In our hospitals, under 2,400 people with COVID-19 were being treated each day, including about 530 in critical care. There are now over 849 variant of concern cases, including 780 B117, 39 B1351, and 1 P1 variant. Overall, we are still doing well, but things could change rapidly, as we have seen recently in Newfoundland and Labrador, where highly contagious variants of concern took hold when public health measures were less stringent. Provincial public health authorities knew something was different when cases escalated over a matter of days, even before laboratory evidence confirmed the presence of the B117 variant. There are also international examples from the United Kingdom and Ireland, where an exponential trajectory occurred following the emergence and rapid predominance of the B117 variant of concern. These areas had public health measures in place, but they proved insufficient to control the spread of a highly contagious variant. Achieving the best case scenario with highly transmissible variants in our midst requires us to continue being vigilant. Any easing of public health measures must be done slowly, with enhanced testing, screening, and genomic analysis to detect variants of concern. In particular, there must be sufficient contact tracing capacity and supports for effective isolation given increased transmissibility of variants of concern. As we head into the spring, vaccination efforts will continue to ramp up, bringing us closer to widespread and lasting control. Recently, we have seen some very encouraging early reports of high vaccine effectiveness among long-term care home residents and healthcare workers in Canada. This gives us hope that those at highest risk of severe outcomes or exposure are benefiting from priority vaccination. Until vaccine access expands to protect all Canadians, our best means of control continues to be our collective effort to slow the spread through enhanced public health measures combined with individual prevention practices. Controlling COVID-19 may not be easy, but we are stronger. Thank you.
Thank you, Dr. New, and Corinne, back to you.
Merci beaucoup. Donc, nous allons passer à la...
Thank you very much. We will now go to question period with one question and one follow-up each.
We'll move on to question period with one question and one follow-up each. Opérateur, première question. First question.
Thank you. Merci. If you have a question, please press star 1 on your device's keypad. Si vous désirez poser une question, appuyez sur étoile 1 de votre appareil. You may cancel your question at any time by pressing star 2. Vous pouvez à tout moment annuler votre question en appuyant sur les touches étoile 2. The first question is from la première question est de Manon Cornelier de Le Devoir. Please go ahead.
Manon Cornelier, Le Devoir. Question.
C'est American Express Global.
American Express Global Travel is responsible for a hotel responsible for quarantine. Was that given without a competition, or was it given with a competition?
C'est Dr. New. Moi, je sais pas.
It's Dr. New. I'm not really aware of the operational details. Oh, the question was from Minister Anand. Oh, okay.
Anita, the question from Manon was around the contracting for the American Express Global Travel Service. I don't have any information, but we can certainly follow up. Anita, do you have any information on that? Or we can, Manon, on pourra facilement.
Manon, we could easily get, well, the minister will know whether there was a bid for tenders or not.
My belief is that there was.
Okay.
Excusez-moi.
Excuse me, I think there was. I think there was a competition, but I will have to check and follow up with a response. And why was the contract given to the private sector?
We use a private contractor for that and not a public servant's service.
Encore une fois.
Once again, I will verify the process with my department and with the Public Health Agency of Canada, with whom we are working. And I will check the information before I weigh in on that. Thank you.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Mia Robson from the Canadian Press. Please go ahead. À vous la parole.
Dr. Tam, my first question is for you. I'm wondering, you said a couple of weeks ago, and I think you repeated it even last week, that we need to do better at screening for these variants. I'm just wondering if we have changed anything in that time, the last couple of weeks, if we are screening anymore, and if not, what else do you still think we need to do?
Thank you for that question. And yes, the actual screening and capacity to do so has increased, I think, quite a bit in Canada. Just as a benchmark, if you like, we were already doing fairly well compared to other countries and screening at about 5% of our positive samples with a goal of 10%. So they're increasing up to that. That's for the whole genome sequencing, sequencing the whole virus, and I'll get to screening in a second. And, we started with about 3,000 sequences, whole genome sequences in December, 5,000 in January, and we're going to exceed that kind of number in February. In terms of screening for a mutation, so here we're talking about a mutation such as the N501Y. And here we are doing quite well with a range of provinces and with support from the National Microbiology Lab for those who can't do it themselves to screen for, I think many are aiming for essentially close to 100% of the lab confirmed cases. And we know that a number of the larger provinces are already at that milestone. Some of them are at about 70%, but they are screening quite a bit. So doing a lot more than what we were before. Ontario, for example, is screening 100% of their positive cases. Nova Scotia and BC are, approaching that kind of range, and Alberta as well. So, and that's just, and then if they're screen positive, of course, they will undergo whole genome sequencing in order to determine if they are the actual variant of concern. The other efforts, other targeted studies, as well as these point prevalent studies that you've seen coming out of certain provinces where you just screen everything on a single point in time, just to get an idea of where those variants might be. So I would say, yes, Canada has made great progress, and we need to continue to do that, particularly as things are sort of easing up. You really need to know where those variants are.
Thank you. And Minister Anand, for you, I think it was about 10 days ago, you said that Canada was getting its AstraZeneca doses from the United States now. And then 3 days later, India said that they were sending us those doses. I'm just wondering if you could clarify why things changed, if things changed, what the situation is with the doses and where Canada's AstraZeneca doses are coming from.
Okay, thank you, Mia, and nice to hear you. Let me be clear that what I said 10 days ago is accurate. Under our bilateral agreement with AstraZeneca, the doses are coming from the United States. We also are engaged with the Serum Institute of India for doses in addition to the 20 million that we have under contract with AstraZeneca. And those doses obviously would be coming from India. Thank you.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Catherine Lévesque de la Presse canadienne.
Catherine Lévesque, Canadian Press. Question. Yes, good afternoon. I would like to come back to the hotels and chaos surrounding reservations for travelers. Mr. LeBlanc, there seems to be confusion with travelers who were unable to obtain hotel reservations before. So I was wondering if you could tell us whether there is a $3,000 fine if they were unable to make reservations, and if they are unable to and it takes them several days to, whether they can get assistance from public servants. If you would allow me to put it into context, for a number of months, the beginning of the pandemic really, we have been encouraging and advising people to not travel. We were consistent and very clear on that matter. We also have said for a number of months that the rules surrounding quarantine and testing could change with very little notice and on a short notice based on additional measures that could protect the Canadian population against COVID-19. The Public Health Agency of Canada entered into a contract with American Express for the matter of hotel room reservations for some hotels upon arrival. We understand the frustration of people that there might be long waits to reserve a room. We are working on improving the statistics for wait times. But we were also clear that people who did not follow the requirement to reserve their hotel room in advance following a testing would be subject to a fine imposed at the discretion of a CBSA officer, for example, up at the point of entry. And we clearly said that there would be fines attached to people who did not fulfill this requirement. And we encourage everyone also to not call to reserve hotel rooms if they do not need a room in the 48 hours following the call, not weeks and weeks in advance, because that means that there may be 25 calls on a given day. My point was that we spoke to travelers who attempted to meet the requirements to stay in a hotel, but they were never able to get through. So I wonder if everyone has tried everything and spent hours on hold trying to reach an agent and book a hotel room, would they be subject to a fine rather? It was if it's up to the CBSA officer. Well, yes, you're right. The fines rest in the hands of CBSA officers, for example, at the point of entry. Politicians are not the ones who decide. The discretion rests in the hands of the CBSA officer, who is responsible for applying the act. I would imagine that that discretion could be used intelligently, and we expect that to be the case. But we also expect Canadians to take the necessary measures to have these hotel rooms booked before their arrival in Canada, and that is in the interest of protecting Canada and Canadians against COVID-19, and it's consistent with what everything we have said for a number of months now about the need to increase protective measures, and this is one of them, which was necessary in our judgment, and which other jurisdictions have also adopted.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Mackenzie Gray de CTV News. Please go ahead. À vous la parole.
Hi there. My first question is for Minister LeBlanc. Minister, a lot of people are concerned about the province's ability to roll out the vaccines. The Prime Minister has been asked about this before, and he said that the province has reassured him on many occasions that they have it well in hand. Has the federal government given offers to the provinces to help with the distribution of vaccines at any point? And can you confirm that they didn't accept your help?
So I think the Prime Minister was accurate when he said that on a number of occasions, the premiers have reassured him that they have the necessary human resources, healthcare professionals to administer a significant ramp up in terms of vaccine deliveries over the next weeks. My colleague Anita Anand, I think, described the very considerable increase in this week and over the coming weeks in terms of the hundreds of thousands of vaccines that will arrive in Canada. We've taken note that the provinces have called on the Government of Canada to deliver as quickly as we can all the vaccines that we can to them. That's exactly what we're doing. But we're also told by the Public Health Agency of Canada that the planning, the cooperative efforts as between General Fortin and his team, for example, and health authorities in every province are in fact very reassuring. The Government of Canada has said to provinces from the very beginning that we obviously are more than happy to support them in any way they think would be constructive. That's been the ongoing dialogue and planning exercise between General Fortin and his counterparts in every province and territory. So we stand ready, of course, to support provinces, but we're also very confident that the provinces have plans in place that will effectively and efficiently and safely vaccinate the hundreds of thousands of Canadians that will be able to get a vaccine in the coming weeks.
My follow-up question is for you, Minister LeBlanc. I'd like to hear from Dr. Tam on this as well. Yesterday, Boris Johnson in the UK said that they're targeting June 21st to lift all restrictions in the UK. I know the government said time and time again that we're going to have enough vaccines in Canada by the end of September to vaccinate everybody. So is it fair to say that some point after that date that we will be able to lift all restrictions and return back to some semblance of normal life?
So I'll answer, and then Dr. Tam may wish to add something. We took note of Prime Minister Johnson's comments with respect to the United Kingdom. Obviously, the decision in terms of public health measures, lockdown measures in Canada are in the hands of provincial authorities. They are assessing on an ongoing basis based on public health advice that they receive, and Dr. Tam and her colleagues are obviously in touch on a very regular basis on all of these matters. So we recognize the understandable sentiment of Canadians that there is a huge desire to return to some semblance of a pre-COVID normal. But we've also said from the beginning that has to be based on the public health advice, the local public health advice, the case counts, the number of hospitalizations, all of these factors that are properly in the hands of experts and scientists and doctors that should inform provincial authorities with respect to these decisions. So we don't, as a national government, purport to set a specific date that would obviously be in the jurisdiction of provinces and territories, but we'll continue to work collaboratively with them, obviously, to do everything we can, particularly in terms of vaccinations, to ensure that we get every Canadian who wants a vaccine vaccinated as quickly as possible. Perhaps Dr. Tam would like to add something.
Yes, so I think we're very encouraged by some of the vaccine effectiveness data, as you've seen, coming out of the United Kingdom. And I think some of the basis upon which some of those comments were made. But there were caveats to those comments too from the United Kingdom. I do think vaccines play an absolutely key role in our return to closer to what the life that we have known. And I think as many people as possible getting vaccinated means that resurgence then becomes less likely. And even before September, I think depending on a number of factors such as vaccine uptake, ongoing monitoring of the variants and how vaccine coverage is provided as the virus could always change over time, of course, but that I think we will see the ability to shift some of those public health measures as the months go by. And September is a target, of course, for as many Canadians as who wants a vaccine getting vaccinated. But I do think that the vaccine will play a critical role in easing of public health measures. The key is to get the vaccination levels high so that we reduce the chances of those massive upswings in resurgence in order to keep society going. So that is absolutely the goal. But I think you can't put an absolute date on one of these things. But having had everybody getting the vaccine, that is a massive step towards returning to a more normal life, while I would say keeping up with your personal, protective measures. The idea is not to reduce the need to have the more restrictive public health measures in the community. But I remain really very hopeful, but we have to go with the data as the science evolves as well.
Merci. Mr. LeBlanc, were you trying to say something? You're on mute. Okay, merci. Prochaine question. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Mélanie Marquis de La Presse.
Mélanie Marquis, La Presse. Question. Good afternoon.
State vaccine problem. First of all, how big a problem is it right now, and how does it work exactly? Are state entities trying to sell vaccines to governments, or is it something that happens on the web where private citizens are offered counterfeit vaccine doses?
Thank you for the question. I missed the first part of what you said, though. So I'll answer the question that I heard, and if I've left anything out, you can ask again. The entities that are coming forward include a number of different types of organizations and suppliers, individuals, corporations, and other intermediaries. So they are an eclectic group of suppliers, and they're coming to us through an eclectic means, whether it is through emails that we are receiving or phone calls. And we are taking all of these offers seriously. And when there is a reason to believe that the offers are fraudulent, the matter is referred to the RCMP. And I want to mention also that our national security advisors are also apprised of the importance of maintaining the integrity of the vaccine supply chain. Across government, we will continue to guard our vaccine supply chain very carefully and ensure that Canadians receive vaccines as soon as possible. We encourage Canadians to refer any offers of vaccines that they believe to be suspicious to the authorities as soon as possible. And finally, we are in regular touch with our suppliers, and so we are able to verify what supply is legitimate and who in particular has legitimate doses. Thank you.
So as a follow-up, I'm just going to ask the first part of the question again, which is, I guess, a general interrogation. How big a problem is it right now? Is it a marginal problem? And also, if you could give, without naming anybody, give specific examples of how it works. You mentioned emails. Could you give us a couple of examples, if you can, of course, with regard to privacy?
So the examples that I have already given are the ones that we are receiving. For example, emails of offers of AstraZeneca and offers via phone calls as well to our department. and we make sure that we are verifying what is a legitimate offer of supply and what is not. And in terms of the question about how large a problem is this, we continue to have access under our bilateral contracts with 7 suppliers to up to 400 million doses of vaccines for Canadians. That will not change, and that is not affected by the security issues that I am raising. The reason I'm raising them, however, is because the federal government isn't the only person or body that is receiving those quote unquote offers of assistance. To my knowledge, they are being offered across the board, and we are worried that provincial governments or municipal governments and other purchasers may be receiving these offers, and we just want to make sure that the RCMP is aware of the potential fraudulent nature of these offers. And as I said, this isn't just a matter of procurement. These are national security issues potentially, and as a result, our national security advisors are also apprised of the importance of maintaining the integrity of the vaccine supply chain, and they will, as they always do, ensure that we are that the vaccine supply chain is seeking to be protected. Thank you.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Tom Perry from CBC News. Please go ahead. À vous la parole.
Hello. Thanks for taking my questions. The first one is for Minister Anand. Minister, the U.S. Food and Drug Administration is supposed to be meeting on Friday to review the vaccine from Johnson & Johnson. I'm just wondering if Johnson & Johnson gets the go-ahead, the green light from Health Canada, soon in the near term, how many shots do you expect will flow to Canada in the second quarter of the Johnson & Johnson vaccine?
Hi, Tom, and thank you for your question. So to start at the beginning, from a procurement standpoint, under our agreement with Johnson & Johnson reached on August 24th, 2020, we are procuring 10 million doses of a 1-dose vaccine, and we have options of up to an additional 28 million doses. Under our contract, deliveries of those 10 million doses are to occur in Q2 and Q3. I spoke with J&J last week to ensure that we are on target in terms of those deliveries and to press them on when precisely those deliveries would be arriving in Canada. And that is a negotiation that we are currently engaged in, and I will provide information relating to the details of those deliveries as soon as I have them from the corporation. At the current time, the key date, of course, is the date on which Health Canada provides a decision with regards to J&J. And as we did with Moderna and Pfizer, we continue to engage in the negotiations with the corporation to ensure the earliest possible delivery from the corporation, the supplier, into this country. And that's exactly what we're doing with all other suppliers, including J&J. We are watching this very, very carefully. Thank you.
So, Minister, then is it fair to say then it's too early to know at this point how many doses of J&J we're going to be getting in Q2, assuming that is that Health Canada gives approval to the vaccine?
That is correct. It is too early to say, and as soon as I have details, I will provide them to you. Of course, from the vaccine supplier standpoint, they're usually reluctant to provide firm delivery dates in a quarter prior to knowing the date on which they will receive authorization from the regulatory body. The reason, on my understanding, is that vaccine suppliers don't want to have vaccines sitting, waiting in any jurisdiction when they could be in arms in other jurisdictions. And so it is important from their perspective, on my understanding, that they are also being efficient in terms of where they're sending vaccine. At every step of the way, I assure vaccine suppliers that Canada is ready for the deployment and distribution of vaccines. That's why we got Moderna into this country earlier than most countries. That's why we got Pfizer here in Canada earlier than most countries. And it has been as a result of that negotiation that we have been able to accelerate deliveries of those vaccine suppliers. Similarly, we are taking also an aggressive approach with J&J and AstraZeneca to assure them that Canada is ready to receive doses. Indeed, Minister Haidu and I wrote a letter to vaccine suppliers prior to receiving any vaccines in this country that Canada is ready and that the Public Health Agency of Canada will be working very closely, as it is, with the provinces and territories to ensure the efficient distribution of vaccine. And that's exactly what has occurred. There is a very strong collaborative working relationship between the Public Health Agency of Canada and the provinces and territories in terms of ensuring efficient and effective distribution of vaccine. We thank Danny Fortin for his work in this regard, and all provinces and territories, and of course, frontline healthcare workers that are delivering these vaccines in as expeditious time as possible. Thank you.
Merci, thank you. We will take two final questions. Nous allons prendre deux dernières questions. Prochaine question, next question.
Thank you. Merci. The next question is from, la prochaine question est de Annie Guillemette de Cogeco Nouvelles. Please go ahead.
Question. Inaudible for the interpreter. The sound is inadequate for interpreting.
Déjà abordé. D'une part, sur le criblage, le séquençage, Dr. Tam, vous en avez parlé. J'aimerais ça que Dr. New, vous nous résumiez la chose. Là. Bon, vous dites qu'on est rendu à peu près 10 des cas positifs actuellement, mais qu'il y en a qui sont déjà à 100, dont, moi je suis au Québec, nos voisins du Sud. Donc, je voulais juste vérifier, c'est quoi l'objectif? Est-ce qu'il est vraiment de cribler ou de séquencer 100 des cas positifs pour avoir un vrai portrait de nos cas suspects de variants?
Donc, je pense qu'on a eu des bonnes discussions.
Answer. We had good discussions with our counterparts in the provinces and territories, but also among lab managers. And in my opinion, we also need to discuss, it's not the best way to be effective with sample testing. Dr. Tam has already said that in the beginning we did genomic sequencing of 5% of samples across the country. Now the target is 10%. In Quebec, I think it's the same 10% target, but it's not just 10%. It's a way of doing testing at the beginning for mutation, for variants already identified here in Canada. And with this first testing, if the sample is positive, genomic sequencing can be conducted in full because it takes a couple of days. It can take 2 to 5 days, so you need to be a bit targeted with our efforts. That's something important. Another thing to note is that it's not just genomic sequencing of all samples. It's targeted within the 10%, but also in cases where there is an event or a case that is related, a super spreader event. It's also important if we see cases that are related to travel, and that's another priority group. And finally, I'm thinking of Quebec, but also across the country. We're always trying to prioritize genomic sequencing for cases tied to someone who is vaccinated, because we always want to closely follow what's happening with people who are vaccinated. We talk about vaccine escape. Is there an event where the vaccine was less effective than expected? That's the general strategy for Quebec and also for Canada, I believe. Thank you. Thank you.
Suivi, est-ce que
For the follow-up, is it possible to move closer to your mic?
le volume aussi?
I can increase the volume. Do you hear me better? Mr. Minister Leblanc, I'd like to hear you in French on the dangers of fraud and the checks of the supply chain and what types of threats the government is facing. Answer. As my colleague Minister Anand said, since the beginning we have established safety measures across the country to ensure the integrity of the supply, the vaccine supply. It's essential for the confidence of Canadians, and Canadians can have a lot of trust in that the national security authorities and police authorities are obviously aware of potential threats, and they conduct checks rigorously, and that has been the case since the beginning. As Minister Anand said, for some time now, individuals who are trying to sell vaccines either to the Government of Canada or perhaps other governments or civil authorities, vaccines that are counterfeit or fraudulent. And with that, obviously, we refer all of these cases to national security and police authorities. But it's also important to note that as a national government, we have contracts in place with vaccine manufacturers, pharmaceutical companies that have received approvals from Health Canada. So everything that is signed by the Government of Canada is with the pharmaceutical companies themselves and not with third parties who claim to have access to vaccines. We just need to be cautious if we advance the idea that an individual or another intermediary could have access to vaccines. Those cases are obviously suspicious, and they are referred, as they should be, to the police, and that has been the case since the beginning. But we have full confidence in access to vaccines that are effective for all Canadians who wish it.
Peut-être je pourrais ajouter.
And if I might add something, Dominic, it was the same thing with N95 masks. We received offers for these masks, and it was the same thing. We referred the matter to the RCMP, and we are doing the same thing now with vaccines. Thank you.
Merci, thank you. We have one final question. Il nous reste une dernière question. Opérateur, à vous.
Thank you. Merci. The last question is from, la dernière question est de Rachel Gilmore from Global News. Please go ahead. À vous la parole.
Hey there. So first and foremost, I wanted to ask about the R rate in Alberta. It's recently jumped back above 1, and I'm wondering how big of a concern that is for you to see an R rate above 1, given the potential for rapid spread from the new variants that are already circulating in Canada. and what your message would be to the people in provinces that are reopening and allowing things like indoor dining once more as these new strains continue to spread and we see these R rates.
Thank you for the question. It's Teresa Tam here, and I think that is one of a number of indicators that needs to be tracked by public health and taken together to look at the trajectory of the pandemic in the specific jurisdiction. But it is one of the parameters. So the RT reproduction number again tells you that one person is passing it on to just slightly above one person, which means the epidemic will be growing or is growing. And so at this juncture, where variants at play, provinces and local health authorities need to be extremely careful about the easing of the measures and have enough testing, tracing, as I said, genomic sequencing capacity in place, and not be not sort of take too much time in further putting on measures if they see the trend going in the wrong direction. And so it is but one measure, but what you want to see when you're easing measures is that the RT number is kept below 1 in a sustained way for a number of weeks. So so they have, everyone who's got this reproduction number that's higher than 1 needs to be extremely careful with public health measures. And as I've said in my last number of weeks, that now is not the time really to release things too fast, because we're just getting the vaccination going and there's variants circulating. So I think it is but one measure, but it's an important one to take into account.
So just as a follow-up, I wanted to follow up on actually what Mac asked earlier in the press conference about, obviously the news out of the UK was pretty exciting. I think a lot of people heard that and started imagining themselves back in bars and normal life resuming. I wanted to ask you guys, I know you said that vaccination is a big boon to that potential, but if you can't set an official date, what metrics are you looking at when it comes to determining whether it's safe to fully reopen? And just to double barrel this question, because I know that's always a favorite, can you give us any kind of a date that you think is unrealistic in terms of imagining we'd still be living like this? Is summer 2022 definitely going to be back to normal? Christmas 2022, I'm just kind of looking to see if you have any broad indicators and what metrics you're using to gauge that.
I'll say a few things and then Dr. Tam can follow up. As we said, we as a national government certainly understand Canadians' excitement about being able to return, I think as Dr. Tam said, to some sense of normal before the pandemic, although some public health measures will likely remain in place for a considerable time. But it's also important to note Canada is a federation where provincial and territorial authorities properly have jurisdiction on a great number of these public health measures. We obviously collaborate, and Dr. Tam and her colleagues work closely with their counterparts in provinces and territories. But your question almost has to be asked the 13 different sub-national governments in Canada in order to be able to come up with that magic answer. But I very much liked your idea of summer 2022. And I didn't know double barreling was a verb in terms of asking questions at a news conference. So I learned something today. Maybe Dr. Tam would like to add something.
Yes, so some of the indicators will not be a surprise to everyone. So in order to ease measures, you have to take into account indicators such as the R value, which you just talked about, the actual epidemic curve in terms of where it's moving, the rates of serious outcomes, including ICU admissions, hospitalizations, and deaths, of course. But the initial trends in cases does give you an idea of what is going on first, because the other indicators are sort of lagging indicators. But you want your healthcare capacity to be able to cope, and you also want the public health capacity for testing, tracing, contact tracing, all to be in place for easing of measures. When you bring the cases down to really low numbers, really low, then you can detect and track and every case and their contacts in order to put them in isolation or quarantine. That is the kind of state that ensures that society can open up more, but then everybody has to do their part in order to maintain that. With variants in play, there's less room for any kind of errors. No one can afford to not do everything that they can, but with more precision. If you're wearing a mask, you got to do that properly. Social distancing. The sort of 3 C's, close, enclosed, crowded, indoor conditions are still the biggest risk. So I think until vaccinations are well underway and all the way through the sort of next months, that's you're not going to be able to do that kind of gathering for non-essential reasons. So I think for now, Canadians should still focus on rolling up your sleeve when it's your turn, and keep up with those measures and do it as diligently as possible. I think, some of the other measures, what we don't know out of all these indicators is, what kind of vaccine coverage levels will achieve sort of community protection. That we will see over time. As you've seen, data is arising every other day from international and other sources. We will be able to tell Canadians the performance of these vaccines, not just reducing incredible results in reducing illness and severe outcomes, whether it would reduce transmission or not, will come, I think, in due course. So we just need to be a little bit patient. Right now, because of the vaccine supply, we just sort of keep on going with that vaccine coverage. But I do think that, this period of time, as I said, this first quarter is going to be very difficult. First quarter is 2021. Next quarter, more vaccines. There'll be much more abilities to be able to titrate some of your public health measures as well. As spring comes along, people can go outside. Big difference. Right now is, as Minister LeBlanc also said, is stay put, staycation, don't go on March break, do all that we can so that the vaccine has a runway to take its course, and just keep your eye on that. And I do believe that between now and September, we're going to see some really great impacts from vaccines. But the variants could give us a sort of surprise. So, it may not be the 3 that we're tracking now. There could be others. So building up that infrastructure to detect them is very important. The other thing is that September is a good time point to aim for as well, because at that point in time, you need to be ready to ensure that you're not going to get a giant fall winter wave the next time around. So getting that vaccine is important, and all the other measures, so that heading into the next winter season, we can reduce the need for really restrictive measures. While I believe we would still have to maintain some of those infection prevention and control practices, what you want to do is go into the next fall and winter season with the confidence that you don't have to do, really strict lockdowns, but remain vigilant, because this virus, I'm sure we haven't seen the last of what it might deal us in terms of surprises, and we just need to be prepared for the realistic worst case scenarios.
Yeah. It's Howard New here. Maybe I'll just add one additional point to what Dr. Tam said, is that, if people talk about when we're going to return to our pre-COVID life, I think the additional point I would make is that, hey, it's a global pandemic and we're so interconnected, with everyone else around the world, that really we can do what we need to do here in Canada. But as we've said before, no one is protected till everyone's protected. So I think, we need to do what we need to do in Canada in terms of vaccination, but we also need to be mindful of what's happening around the world, ensuring equitable access to vaccines in many other countries, because, you know, with travel and all these other measures we have at the borders in different countries, I think if we really want to return as much as possible to the sort of the world as we knew it before COVID, we need to also have a global view in terms of what we can do to contribute to sort of a global sort of response rather than just looking inwardly in terms of what we're doing here in Canada. So that's the only other additional point. Thanks.
Merci à tous. Ceci met fin à la conférence de presse d'aujourd'hui. Thank you, everyone. This puts an end to today's press conference.
Merci beaucoup.